Brownsville. I'm Michelle Jones with the City of Brownsville Public Health Department, Maternal and Child Health Division. And today we've got some lovely guests here. We're going to be talking about congenital syphilis and some of the situations here in Brownsville. So they've got really good information. Do you guys want to go ahead and introduce yourselves?
Go ahead. Hi, my name is Dina Valladares. I work for the UTRGV School of Medicine, and my position there is a graduate researcher for congenital syphilis.
And I'm Alina Flores. I also work for UTRGV School of Medicine. I am a program assistant for the congenital syphilis.
Okay. All right, so just to begin with, some people might not know what syphilis is. So do you mind just letting us know what is syphilis?
Okay, so syphilis typically is a bacterial infection that passes, congenital syphilis specifically, passes from the mother to the baby. Mm-hmm. Syphilis in itself is a bacterial infection that can be transmitted through sexual contact, okay, whether it be oral, anal, or vaginal.
Mm-hmm. All right, and is there a progression? If let's say the mother has syphilis, is there a progression of symptoms or stages or anything like that?
So syphilis has a total of 3 stages. Mm-hmm. The first one is called the first stage. And in that stage, you have painless sores. Mm-hmm. It's normally located in the area of infection. It's like on here or on the genital area. Mm-hmm. And they're usually painless. Mm-hmm. Then we progress into the second stage. And that one, you can get rashes all over your body. Mm-hmm. And when that happens, usually it kind of stops for a little bit. That's from 4 to 10 weeks, give or take. And then after that, it kind of goes dormant. It kind of goes no signs, no symptoms, which is called a latent phase. That's a little known or a special word to say. It just kind of disappears for a little bit. It's still in the system. And then we progress into the third stage. And that third stage can go up to 15 years. You can have the infection for 15 years if untreated. And that's when it attacks the organs, the heart, and the brain.
Okay. So since one of the things that you had mentioned when it goes into the latent stage, or you might get a painless sore or a rash, is this something that all women are tested for when they become pregnant?
Yes.
Okay, good. And so what do we need to know about syphilis while we're pregnant?
Okay, so the CDC does recommend that mothers get tested during their first prenatal visit. Mm-hmm. And during that first prenatal visit, they have to follow up on their second, third, to make sure if they're at higher risk, it's more likely that they get tested more often. Okay. And things that mothers should know is that they do not get treatment, that can have really adverse effects or really bad effects, not just on themselves, but on their child. Okay.
So what would be some of the things that would happen to a child if they go untreated?
So the first thing that can happen, it's called an early symptom, and that happens during as soon as they're born up to 2 years. What can happen there is that a child can develop deafness. They can go deaf. They can go blind. They can get joint deformities or bone deformities, which their bones are abnormal. They can also develop rashes on their body. And if they progress after 2 years, they can also have difficulty learning. They can have it can remain the blindness, the deafness. Also, they can develop teeth, like teeth that are kind of pointy. And it can also not allow them to properly walk and learn developmental issues. So
it's very important for all women to make sure that they are hitting those prenatal visits and making sure that they're following up with their doctors for all of their needs. So another question is like one thing that we always talk about is breastfeeding, because we know breastfeeding is really good for babies. They get the optimal nutrition and it's great for mothers. So if a mother has syphilis and is unaware, or does that get passed on through, can that also go into the baby through the breast milk?
Not necessarily through the breast milk.
Just through
if they have a sores. Again, if they go untreated with the syphilis, they could have sores. And those sores can be presented in the breast. And that's the transmission that can happen. That's where it can be passed down to the baby.
But the baby just drinking the breast milk, it should not pass it.
Okay, so it would have to actually touch those sores and have that contact, because I guess that would be almost like an oral transmission at that
Yes.
point. Okay, all right, good to know. And then let's say a mother is being treated, and so she's on, it's an antibiotic treatment,
Yes.
and while she's on that treatment, it's fine for the baby to continue breastfeeding, or is that something they need to engage?
They can breastfeed. When you have congenital syphilis, they give you a penicillin.
Mm-hmm.
You can give penicillin directly to a child,
Yeah.
depending if they're not allergic, things like that. But before the penicillin hits the breast milk, it is, processed twice through the body, so that baby hardly gets any penicillin. through breast
Okay,
milk.
all right, good. All right, that's good. And then since we are talking about this, is this something that we need to be concerned about down here in the valley? Like, what is the situation here locally?
Yes, actually, surprisingly, Texas is ranked one of the highest cases of congenital syphilis in all the United States. And when we go down to the valley, Hispanics are 45% of all the cases in the United States. Specifically, the valley has one of the most highest cases on all Texas.
Oh, yeah. So definitely we need to be concerned about that.
Absolutely.
So since it is such a prevalent disease here in the valley, I think the most important thing that we need to reiterate to people is making sure that you are going to your doctor, getting those checkups, and then also to know that it's treatable. It's not something that you have to live with forever, or because I think it could be stigmatized since it is considered as sexually transmitted. So you can just go into your doctor, get that treatment, and we don't have to have some of those lingering effects later on. So that's the big takeaway. One of the things that we also talk about is prevention, so what's the best ways of protecting yourself to be sure that you aren't contracting syphilis?
Well, the absolute best way is to not have sex,
Yeah.
any kind of sex.
Mm-hmm.
And it's very unlikely for people not to. So the second best is condoms, birth control, protect yourself, protect your partner, that kind of thing.
Okay. Right.
And I think it's a little bit important to emphasize that the partner should also be tested. A lot of the times we just focus on the mother. Your partner should also be tested. If you suspect that you have syphilis, the contamination can keep happening if your partner is not tested and treated.
All right, so do doctors, if they do diagnose the female, do they automatically go to the father also, or is that something that's left up due to patient confidentiality and HIPAA guidelines? Is the doctor then able to reach out, or is that something that the different public health departments would end up doing?
I think it's recommended for, as confidentiality says, the partner, the female partner, to inform the male partner of that. It's highly unlikely that the public health will reach out unless consented through both the male and the female partner. I think it's really important that we have a tendency to just say, oh, it's the female, get treated and stuff. I think a lot of the times we discard the male partner or the partner in general and not say that it's important for both of them to get tested. It's important to help treatment for both of them. And that this is an increasing case. That's why we're bringing awareness, because it's not decreasing. We've increased in Texas 650% in the total United States. And in Texas, it's 28% of people. So that's more than a quarter of people. So I think it's really important to emphasize how these cases keep increasing.
Okay. Since we're talking about being tested, what is the process for being tested for both male and for a female? Is it like a swabbing, or?
So usually they do serological testing, which means just through the blood, you get blood work done and you can see the antigens and antibodies that are found. So typically they recommend blood work for that.
All right. And could any of the other, like any clinic, be able to perform something like that for the most part?
They can perform it if requested, but it would be usually at a higher cost. You would have to find a place that provides things at a low cost that adjusts to your needs, financial needs.
So do you have any information or clinics that are actually doing some of these testing? So that way when we do have some of our viewers that might, just for peace of mind, want to be tested, where would they go?
Perfect. Yes, we do have a list of clinics that they could contact us through Facebook or Instagram. that we could, or through email that we could send to them so they can see areas either in Cameron, Hidalgo, or Willacy County.
Oh, so you've got a wide stretch. So
Yes.
that's great. So even if there's someone from outside of Cameron County that's watching this, they can also reach out to you guys to get testing. So I'd just like to thank you all for coming down and sharing that really good information with us, because I know the residents of Brownsville really appreciate it. We'd also like to thank the Breastfeeding for a Healthy Brownsville Community Coalition for making all this happen. Of course, the City of Brownsville for bringing it together. And we'd like to let all of the residents of Brownsville know that if you do have any questions or concerns when it comes to syphilis and congenital syphilis, you can always contact Ms. Dina and Ms. Alina through the information that's provided on the screen right now.
All right, and thank you for having us.
Thank you.